The fluorescent lights of Oak Creek Memorial's ER buzz overhead like angry insects as Hannah Clarke finishes her third double shift this week, the antiseptic smell mixing with old coffee and something metallic underneath, blood that never quite washes out of the air. She moves through the trauma bay with invisible efficiency, her hands steady as surgical lasers when starting fours in moving gurneys, her 3-second triage assessments always correct, always fast. Nobody asks questions about the nurse who can intubate a seizing patient while the stretcher's still rolling, or who knows exactly which antibiotics to have ready before the doctor even enters the room. She doesn't volunteer information. She doesn't make eye contact during rounds. She keeps her head down the way someone keeps their head down when they're used to being invisible. On her locker shelf sits a pair of worn combat boots she never explains. The leather is cracked. The laces are frayed. The insoles are pressed with the shape of 18 years of standing, walking, running across terrain she's forbidden from naming. She touches them once a shift, just once, fingers brushing the rough fabric, and then she closes the locker door. Nobody notices. Nobody asks. This is exactly how she needs it. Dr. Sterling watches her from the physician station with the careful attention of a man calculating angles. He sees efficiency. He sees a threat. His pharmaceutical kickback arrangement with trimmed supply depends on inflated trauma codes, coding a simple laceration as a complicated wound needing premium sutures, ordering level 3 trauma supplies when level 1 would suffice, and the kickback checks arrive quietly, $3,000 a month, sometimes for when a particularly creative billing cycle goes through. But this nurse, this one who moves like muscle memory had muscles, this one notices things. She flags supply orders that don't match procedures. She questions why they're stocking $847 worth of equipment for a routine appendectomy when 20% of it gets thrown away unused. She's been at Oak Creek Memorial for 7 weeks and she's already seen patterns. He approaches the nurse's station with a predatory smile, his Rolex catching the harsh light. The watch costs more than Hannah makes in a month. The smile costs nothing. Clarke. He says her last name like it's a medical diagnosis. You're on the schedule for the Hendricks appendectomy in 20 minutes. I'll be assisting. Hannah looks up from her patient notes, and her expression is exactly what he expects, compliant, slightly anxious, eager to please. Yes, Dr. Sterling. Good. I need you to pay attention to efficiency. Speed matters. We don't need to be artists. We need to be fast. He leans against the counter, watching her. He's testing. He always tests first. You understand that? Understood. She returns to her notes without hesitation. Without pride. Without anything that looks like confidence. He nicks his chin toward the surgical suite. 20 minutes. The operating room smells like ozone and anticipation. The equipment gleams under lights so bright they cast no shadows. The Army Ranger anesthesiologist, call sign Breaker, stationed at Fitzsimmons, here for a rotation of civilian surgical support, is already prepping the patient, his hands moving with the same invisible efficiency that Hannah brings to every task. Breaker is 28, built like a fire hydrant made of muscle, with the kind of calm that only comes from having already survived the worst. He nods to Hannah when she enters. She nods back. The patient, Edward Hendricks, a 63-year-old accountant with appendicitis that's progressing toward rupture, is already unconscious when Sterling enters. Breaker's been doing this for 4 years, 98 combat surgical cases in 3 separate deployments, all of them in operating theaters that didn't have walls, that had mortars instead of monitors. He's administered anesthesia in the dirt behind a burnt-out mosque. He knows how to keep people breathing when everything wants them to stop. Sterling makes the initial incision. Clean. Competent. He's done 2,000 of these. Hannah begins the closure while he dictates the procedure. Breaker watches from his position at the anesthetic equipment, his attention split between monitors and technique. Sterling moves to the door, a phone call he's been waiting for about a supply delivery from Trimmed, leaving Hannah to close. Standard closure, Clarke. Nothing fancy. She doesn't answer. She doesn't need to. Her hands move like they're performing a ritual they've performed 10,000 times. First layer, interrupted stitches through the peritoneum, each stitch placed with mathematical precision. Second layer, the fascia, running stitch this time, the suture pulled tight but not so tight it will cut through tissue, leaving a margin of exactly 3 mm on either side. Third layer, subcutaneous, and then skin, the kind of closure that will barely scar, that will look like it was never opened at all. The kind of closure that requires not just training but experience, and not just experience but experience in a place where you have to close bodies in 12 minutes before the next mortar round comes in. Breaker's hand tightens on the anesthetic mask. He stops breathing for 2 seconds. He knows that closure technique. He's seen it exactly once before, on a forward surgical team in Baghdad, 2009, at FOB Shank in Logar province, during a mass casualty situation where one of the medical officers had taught a rotating group of combat medics how to close wounds the way trauma surgeons do, fast and clean and permanent, leaving the minimum possible scarring on soldiers who needed to survive another 7 months of deployment. 3-layer closure. Peritoneum, fascia, skin. The exact sequence. The exact spacing. His eyes lock on Hannah's hands. The stitches are silver thread moving through blood-bright tissue. Her fingers are steady. Her breathing hasn't changed. She doesn't know he's watching her like she's a ghost. Breaker leans forward slightly, his jaw tight, his eyes moving from her hands to her face. She doesn't look up. She never looks up during procedures. She's looking at the wound. She's looking through the wound. She's looking at something behind the wound that nobody else can see. The last stitch goes in. She cuts the thread. The closure is complete. 8 minutes. Sterling's procedure would have taken 12 to close. Hannah does it in 8, and the wound looks like it will hold anything, survive anything, disappear into scar tissue the way trauma should disappear if you have the skill to make it fade. Sterling re-enters and examines her work with a clinical eye that sees only competence, not threat. Fine. Adequate. Adequate. The word hangs in the operating room like a slur. Breaker is still staring at Hannah's hands. Trauma surgeon hands. Combat medic hands. Special operations medical officer hands. As they're removing gloves, Breaker steps beside her, close enough that only she can hear. His voice drops from professional to something that sounds like recognition. Something that sounds like someone who's seen the exact thing she's hiding. Where did you learn to suture like that? Hannah's breathing changes. Just slightly. Just for half a second. She doesn't look at him. She peels off her second glove, turning it inside out the way you do to contain contamination, and her voice comes out steady, careful, rehearsed. Nursing school. Critical care rotation. She drops the gloves in the biohazard bin. The slam of the lid sounds like a door closing. I watch YouTube videos. I practice on synthetic models at home. It's not a lie. It's layers of truth stacked like her surgical closure, each one true but none of them the whole truth. Breaker studies her profile for 3 seconds. His lips press into a line. He knows she's deflecting. He knows because he's been trained to read evasion, and she's performing it like someone who's been performing it for years. But what he also knows is that you don't learn 3-layer closure from YouTube. You learn it in a pre-deployment surgical course. You learn it in a forward operating base. You learn it under fire. That's really something, Breaker says quietly. And then he walks away. Hannah's hands shake for exactly 4 seconds after he leaves the operating room. She stands at the sink, washing her hands with scalding water, and she watches the suds swirl down the drain. The combat boots on her locker shelf suddenly feel very heavy. The pair of worn boots that cost $1,400 in 2009 and smell like dust from a place she's forbidden from remembering. The boots that left footprints across operating theaters in Helmand Province, in Logar Province, in the FOB Shank surgical suite where she worked 30-hour shifts during peak casualty season. She dries her hands. Her hands are steady again. By the time she exits the surgical suite, she's invisible again. Dr. Sterling is in his office making calls about trim supply, completely unaware that in the operating room, an Army Ranger anesthesiologist just recognized something he's trained to find. Sterling sees Hannah Clarke as a potential liability. What he doesn't know is that liability is a word that describes a nurse who double-checks medication orders and flags unnecessary procedures. What Breaker knows is that he's standing next to a legend. What Hannah knows is that she's been invisible for 18 years and it only takes one person who knows how to look to make that invisibility collapse. She returns to the nurse's station and opens her locker. She touches the combat boots. The leather is real. The history is real. The 18 years are real. But her name on this floor is just Hannah Clarke, and that's the only name that matters now. The ER monitors continue their electronic rhythm. Somewhere in Trauma Bay 3, a patient is asking for pain medication. Somewhere in pediatrics, a child is screaming. Somewhere in Sterling's office, a pharmaceutical company is preparing another kickback check. And somewhere in the surgical observation area, Breaker is staring at his hands and wondering if the forward surgical team medic who saved 17 soldiers in Baghdad under fire is now starting fours in the same hospital where he consults. He's wrong about one thing. It wasn't 17 soldiers. The break room at Oak Creek Memorial smelled like burnt coffee and the particular desperation of nurses hitting hour 16 of a double shift. Hannah stood at the sink, rinsing her cup, listening to the fluorescent lights hum their electric song above her head. Dr. Sterling was already there, back against the counter, wearing his white coat like armor. 12 staff members filled the small space: residents, nurses, a respiratory tech, 2 orderlies. A room full of witnesses. Exactly what he wanted. "I'm taking bets," Sterling announced, his voice cutting through the room like a scalpel. "Our little mouse here won't last a week. Any takers?" He wrote on the whiteboard in red marker, letters sharp and aggressive, "Mouse quits BY Friday." Someone laughed, a nervous sound, the kind that happens when people aren't sure if cruelty is a joke. Hannah kept her back to the room, hand steady under the faucet. Water ran over her knuckles, warm and clear. She could feel his eyes on her spine. "I'll take that bet," said Dr. Reeves, one of the senior attendings. "She's too sharp to crack that easy." Sterling smiled like a predator showing teeth. "The mouse is tough in the ER. Different animal in the game of survival, though. Different animal entirely." He glanced at Hannah. "Right, mouse? Already seen the light of a better job somewhere." She turned off the water. Hands stayed steady as she dried them on a paper towel. One measured breath. Just one. She didn't turn around. She walked past him toward the door, and the room parted like water. Nobody said anything. That was the thing about Sterling, he didn't need responses. He needed an audience. The next 2 days were a masterclass in calculated psychological warfare. Sterling wasn't shouting or threatening. He was being surgical. Precise. He'd studied Hannah's patterns, learned when she took lunch, where she sat in the cafeteria at 1:17 p.m. every shift when she had 14 minutes before rounds. On day 3, during the lunch rush, the cafeteria was full. 70 people minimum. Trays clattered. The industrial dishwasher roared from the kitchen. The smell of institutional beef stew and something fried hung in the air like a fog. Hannah sat at a corner table with a bowl of soup and a salad, reading an old medical journal she kept in her locker. She wasn't looking up when Sterling walked past. His hip caught the edge of her tray with the precision of someone who'd practiced the motion in private. The bowl flipped. The plate followed. Silverware went everywhere, fork, spoon, knife scattered across the tile floor like shrapnel. The soup spread in a rust-colored stain that looked like something from a trauma bay. The room went dead silent. 70 heads turned. 70 pairs of eyes locked onto the nurse on the floor and the surgeon standing over her with an expression of casual concern. "Oh, Christ, I'm sorry," Sterling said, his voice dripping with false apology. "Clumsy me." "Careful, mouse. We can't have clumsy nurses around sharp objects." Infections, liability, you know how it is. He was smiling. Nobody else was. Hannah knelt slowly, gathering the scattered silverware into her hand. Her movements had the precision of someone who'd done harder things than pick up drop trays, someone whose hands had known the weight of different instruments, heavier ones that meant the difference between breathing and bleeding out. One measured breath. A single tear formed at the corner of her left eye, tracking down her cheek without drama, without sound. She wiped it away with the back of her wrist without breaking eye contact with the floor. The other nurses watched. Sterling watched. His jaw tightened slightly, just a flicker, because the tear was supposed to be the breaking point. The tear was supposed to be surrender. Instead, Hannah rose, holding the tray in both hands like an offering. Her voice came out steady as a flatline monitor, each word carrying the weight of something far heavier than a cafeteria incident. I've handled sharper things than cafeteria knives, Doctor. The silence stretched. Sterling's expression flickered, annoyance, confusion, something darker. He turned away. The room exhaled. The assault continued, methodical and escalating. That evening, during evening rounds at the nursing station in front of 12 residents and 3 senior nurses, Sterling held a patient chart in his hand. It was one of Hannah's cases, a woman with appendicitis waiting for pre-op clearance. Sterling looked at the documentation, made a small sound of disapproval, and threw the chart at Hannah's feet. Paper scattered across the tile in a cascade of white. Charts didn't do that often. They represented work. They represented continuity. They represented the fragile chain of communication that kept patients alive. "Pick that up, sweetheart," Sterling said, his smirk sharp enough to draw blood. His voice was pure honey, the worst kind. The kind that made it sound like he was doing her a favor by letting her exist in the same room. Hannah crouched slowly. The fluorescent lights hummed their electric song above her head. She gathered the pages with deliberate care, reassembling the chart in the correct order: patient demographics, vital signs, lab work, provider notes. Her hands moved through the motions like someone who'd sorted through worse debris than scattered paperwork. When she rose, she held the chart in both hands and placed it gently on Sterling's palm, her movement formal as a ceremony. One measured breath. One tear escaped the corner of her eye and tracked down her cheek. She wiped it with the same unhurried precision, and when she spoke, her voice carried something underneath, not anger, not fear, but something carved from stone. "I've stood in worse places than at your feet, Doctor." The room froze. Residents stared. Senior nurses exchanged glances. Sterling's face tightened, his jaw clenching so hard you could see the muscle working under his skin. This wasn't breaking. This wasn't the meek little nurse crumbling under pressure. This was something else entirely, something with a spine made of different material than he'd anticipated. His hand closed on the chart. He turned and walked away without responding, which was somehow worse than any comeback he could have made. Silence filled the space where words should have been, and in that silence lived his first real understanding that something wasn't adding up. What he didn't know was that the woman he was systematically trying to destroy had already survived countdowns far more lethal than his psychological games. But that understanding was still hours away. That same afternoon, during a routine appendectomy in OR 3, Hannah assisted the surgical team with her typical precision. The patient was a 38-year-old male with a classic acute presentation, RLQ pain, fever of 101.2, elevated WBC at 14,200. The anesthesiologist assisting was Captain Marcus Webb, Army Ranger, attached to the hospital's trauma rotation. He watched Hannah work with the kind of professional appreciation that comes from recognizing excellence. Then Hannah began the closure. External oblique first, running lock technique with 2-0 absorbable suture. Internal oblique. Transversus abdominis. 3 distinct layers with a specific pattern that wasn't standard civilian technique, not wrong, just different. It was the kind of closure taught in forward surgical team training, the kind that assumed the patient might be loaded onto a helicopter in 30 seconds flat. The kind that prioritized hemostasis and speed over cosmetic perfection. Captain Webb's hand stilled mid-task. His eyes locked onto hers across the surgical field. "Where did you learn to suture like that?" His voice was low, barely above a whisper, but in an operating room, whispers carry weight. Hannah's hands didn't pause. Her voice came out flat, professional, the way you answer clinical questions. "I've worked a lot of hours." Her jaw tightened slightly, just a millimeter, but it was enough for someone who knew how to read micro-expressions. Someone who'd been trained to read them. Webb leaned closer, studying the pattern of her closure with the intensity of a man looking at evidence. "That's forward surgical team protocol. Baghdad deployment standard. They only taught that to combat medics attached to." He stopped. Hannah cut the final suture with precise movements and didn't look up. "I need to focus, Captain." But it was too late. Webb had already seen what he needed to see. After the case, scrubbing out in the scrub room, he approached her while she was peeling off her gloves. The smell of surgical soap hung in the air between them. He kept his voice low, a military habit, the automatic compartmentalization of classified information in public spaces. "I was 75th Regiment," Webb said quietly. "Phi Base Falcon, 2009, Loga Province. There was a medevac extraction, all-female crew, forward surgical team attached to Task Force Ranger. They pulled 12 of us out of an ambush near Sadra City. The lead medic had hands exactly like yours. The same kind of closure. The same precision." He paused, watching her face. "The whole team died when their bird went down 2 weeks later. Aircraft incident near FOB Shank. All KIA. Classified at the time, but it's in the declassified files now. All of them." Hannah turned off the water. The sound of it stopping seemed louder than the sound of it running. She kept her hands under the faucet even after it was off, water dripping from her fingers onto the steel of the sink. She didn't turn around. "You're mistaken," she said quietly. "I've never been to Baghdad." Webb backed away slowly. The whole team got a Joint Meritorious Unit Award. Posthumous. Buried in the archives. He paused at the door. "I just wanted to say thank you. Even if I'm remembering wrong. Thank you for being the kind of person who saves people." Then he was gone, the door swinging shut behind him with a soft click that sounded like a vault closing. Hannah dried her hands. The paper towel rasped against her skin. She looked down at her wrists, the left one showing a thin white line of scar tissue that curved around her radius bone, visible when her sleeve rode up. Shrapnel scar. Baghdad pattern. Unmistakable to anyone who knew what to look for. She pulled her sleeve down and left the scrub room without responding. That evening, Sterling made a phone call from his office. He'd noticed the interaction between Webb and Hannah, noticed the intensity of it, noticed something that didn't fit the narrative he'd constructed. The woman was too composed. Too skilled. Too dangerous in ways he couldn't quite name. He called his contact on the hospital board, a board member named Garrison who owed him favors. Golf favors. The kind that came with 6-figure consulting contracts and no questions asked. "We have an issue with one of the ER nurses," Sterling said into the phone. His voice was reasonable. Clinical. "I'm concerned about her mental stability. I've observed some concerning behavior, lack of appropriate professional boundaries. I think we need to fast-track an evaluation. I have documentation I can provide to risk management." He didn't mention the suturing technique. He didn't mention the conversation with Webb. He didn't mention the way she'd responded to his humiliation attempts with something that looked a lot like military bearing under pressure. What he mentioned was vague enough to be official. Specific enough to be credible. Dangerous enough to trigger the machinery of institutional self-protection. The gears were already turning. Somewhere in the Denver Federal Building, a file had recently been unsealed, a classified medevac operation from 2009 that had killed 12 Army Rangers and the 5-person forward surgical team that tried to save them. Somewhere in a Pentagon database, a woman's official record had been expunged from all systems except the classified files. And somewhere in the depths of the hospital, a nurse named Hannah Clarke continued her evening rounds, knowing that the past didn't stay buried as long as witnesses remained alive. But that knowledge was still a few hours away. For now, there was only the present, the fluorescent lights humming their electric song, the beeping of monitors, the steady rhythm of a hospital that didn't know it was about to collide with something far more dangerous than a surgical error or a billing scheme. The next words out of Sterling's mouth would change everything. The next voice they heard wasn't a doctor calling orders. It was a siren wailing 3 blocks away, getting closer. The ambulance bay doors slammed open and trauma hit the floor like violence itself, a stretcher moving at full speed, paramedics yelling vitals, a young man's body covered in blood and torn fabric, his chest heaving wrong, asymmetrical, one side moving when it shouldn't. 28-year-old male, stab wounds to the anterior thorax, ×3, found downtown behind the Commerce Street warehouse, one paramedic was shouting. No ID on the victim, seizing on scene, lost consciousness twice in transport, O2 sat was 89 when we picked him up, dropped to 76 en route. The stretcher rolled into trauma bay 4 and the room contracted. Monitors screaming. 7 people suddenly moving in practiced choreography. Dr. Sterling was already there, already reaching for the patient's chart, already making decisions that sounded like authority but landed like theater. "Get me a 7.0 endotracheal tube," Sterling called, his voice sharp and certain. 2 large bore 4s, type O negative uncrossed, and get respiratory standing by. We're looking at tension pneumothorax, maybe flail chest. Let's move, people. This one's crashing. Hannah was at the crash cart before Sterling finished speaking. She grabbed trauma shears and cut away the patient's shirt, a brown cotton work shirt, probably cost $12 at a discount retailer, now soaked through with blood the color of rust and motor oil. The young man's ribs were exposed. Multiple puncture wounds, dark and precise, the kind that meant someone with training or intent had done this. His lips were already taking on a dusky blue tint. Cyanotic. The body turning on itself. She looked at his chest. Asymmetric rise. The right side expanded with each gasping breath. The left side moved like an afterthought, shallow and wrong. She placed her stethoscope on the left anterior axillary line and heard nothing, no breath sounds, just the sound of air that shouldn't be there, the wet rattling of fluid or blood or both. Distended neck veins. The textbook sign screaming at her in medical shorthand that his left lung had collapsed and pressure was building in his chest cavity, pushing against his heart, cutting off the blood flow to the organs that needed it. Tension pneumothorax. Not maybe. Absolutely. The oxygen saturation monitor was already screaming, 82, 79, 76. Dropping fast. "Doctor, he needs immediate decompression," Hannah said. Her voice didn't shake. It never did. 17 years of training, of watching people die when protocols moved slower than the clock, of understanding that hesitation was another word for murder, all of it was in her hands now, in the steadiness of her breath. Sterling whirled on her. His jaw tightened. His eyes went flat and cold in a way that suggested he'd been waiting for this moment, waiting for her to step out of line so he could finally push. "I didn't ask for your opinion, Mouse," he said. The word fell like a slap. Prep intubation. Now. The attending physician will make the clinical decisions on this floor, not the nursing staff. Hannah's hands were already moving. She reached for the 14-gauge angiocath needle from the crash cart, the silver one with the blue hub, the one designed for exactly this moment, for the brief window between recognition and death. The monitor was her metronome now, 74, 71, 69. His blood pressure was dropping. His heart rate climbing past 140, past 150, the desperate acceleration of an organ running out of oxygen, the machine panicking in the only language it had. Sterling was calling for the intubation tray. A respiratory tech was moving toward the patient's head. The attending physician was preparing to do what protocol demanded, secure the airway. Push medications. Make the moves that looked right on a chart but would mean nothing if the pressure inside that chest wasn't relieved first. The patient would be intubated and sedated and dead within 90 seconds because the real problem, the collapsed lung, the pressure, the air trapped where it shouldn't be, would still be suffocating him from the inside. Hannah located the second intercostal space, midclavicular line, the anatomical landmark written into her muscle memory from a training program that was supposed to be classified, from a surgical team in a place she was ordered never to speak about. She didn't think. Thinking was for people who had time. Her hands moved the way they'd moved 14 years ago when the convoy ahead had taken fire and the medic bag was in her hands and her only job was to keep people from bleeding out before the helicopter could land. The needle went in. 2 centimeters. The angle precise. The pressure immediate. The hiss. That sound, the sound of air escaping, the sound of pressure equipping, the sound of death deferring by another few minutes, filled the room like a held breath finally released. The patient gasped. His body convulsed and then stilled, his lungs suddenly able to expand, his oxygen-starved blood finally getting the oxygen it had been screaming for. The monitor climbed, 77, 82, 88, 91. "What the hell are you doing?" Sterling's voice was a weapon now, sharp and furious. "You just violated every protocol on this floor. You're not authorized to perform procedures. You're a nurse, Clarke, not a surgeon. You just crossed a line that means your employment is finished. Do you understand me?" Hannah secured the needle with tape. Her hands were steady. Her breath was steady. The patient was breathing. The oxygen saturation was climbing. The crisis was moving from immediate to manageable, from death to survival, from the kind of collapse that doesn't forgive hesitation to the kind that might, just might, let this young man live to see another day. That was when the combat badge tumbled onto the trauma bay floor. It had been pinned inside the patient's shredded jacket, the jacket that was now part of the growing pile of cutaway clothing on the edge of the trauma bay. A Ranger tab. Faded. Worn. The kind of badge that wasn't given out for service hours or good attendance. The kind earned in places where the heat could melt skin and the dust could coat your teeth and the sound of incoming fire became as familiar as your own heartbeat. And printed on it, in faded lettering, were the deployment dates: Baghdad. 2009, 3rd Battalion, 75th Ranger Regiment. 375ths. The unit. Hannah's eyes locked on the badge. Her hands were moving to pick it up before her brain caught up, before the rational part of her mind that had spent 17 years learning how to compartmentalize could stop her. The badge was in her palm and her hand was trembling, not from fear, not from doubt, but from the kind of recognition that shatters the walls you build to keep yourself safe. She knew this unit. She had been embedded with this unit. In 2009, in a kill zone near Fallujah, in a medevac operation that was supposed to be buried along with the soldiers who didn't make it home. She had pulled 3 Rangers from a burning Humvee. She had kept one of them alive for the 47 minutes it took the helicopter to land. She had held his hand while the medics loaded him onto the aircraft, and then she had been told, by officers with blank faces and voices like ice, that the operation had never happened, that she had never been there, that the entire medevac was classified to a level so high that speaking about it to anyone, ever, would mean federal charges and a prison cell. The badge felt like radioactive metal in her hands. Like a secret that was suddenly not a secret anymore. Like 17 years of anonymity collapsing in a single moment. Sterling was already moving. He pulled his phone from his pocket. His voice was different now, not angry, but satisfied. The satisfaction of someone who had finally caught the proof he needed that she was unstable, that she was dangerous, that she was a liability that needed to be removed from his hospital before she did any more damage to his carefully constructed empire of phantom billing and inflated trauma codes. "Get me Roger Hartman from the board," Sterling said into the phone. "Tell him it's urgent. And start pulling her employment references. I want every number, every hospital, every supervisor. I want to know if there's a pattern here. Because I just watched one of my nursing staff commit a criminal violation of scope of practice while acting like some kind of military-trained operative, and I want every piece of evidence that proves she's unstable before she destroys someone's family." Hannah set the badge down on the instrument tray with the same precision she had set down the needle. The patient's oxygen saturation was at 93 now. His color was coming back. His blood pressure was climbing towards something that might be survivable. The crisis had moved into the space between immediate death and possible recovery, and that space was everything. But in that space, the walls were coming down. The monitor beeped its steady rhythm. The ventilator wheezed. The fluorescent lights hummed their electric song, indifferent to the fact that something in the room had shifted, something fundamental had broken, and Hannah Clarke was no longer just a nurse moving through the world unseen. She was something else now. Something that was about to walk into the light whether she was ready or not. Sterling's hands moved before his mind caught up. The trauma bay was still vibrating with adrenaline, the John Doe's oxygen saturation climbing steadily, 88, 91, 95, and Sterling couldn't accept that Hannah had just saved a life he'd been watching die. He stripped off his gloves and walked straight out of the bay, past the nurse's station, through the administrative corridor, and into his office on the 3rd floor. The door clicked shut. His fingers found Roger Hartman's number in his phone before he even sat down. "Roger? It's David. We have a situation at Oak Creek. 20 minutes. That's all it took for Sterling to paint Hannah as unstable, dangerous, a liability. He didn't mention the phantom billing. He didn't mention the trim supply kickback arrangement that had funded his vacation home in Vail. He mentioned only what mattered: she performed an invasive procedure without authorization. Needle decompression. Could have caused a tension hematoma, a brachial plexus injury. She could have killed that patient. And that's just the medical negligence. Roger, I'm concerned about her mental state. Erratic behavior, boundary issues, speaking to patients in ways that suggest emotional dysregulation." Hartman, whose golf score and offshore accounts both benefited from the phantom billing scheme, heard only one thing: threat to the arrangement. "I'll make some calls. We'll have risk management in your office within 2 hours." The second set of calls was worse because it was deliberate. Sterling held Hannah's personnel file, the one with the carefully fabricated employment history she'd built for herself. Previous hospital in Nebraska. Clinic in Kansas. Both references were phone numbers that connected to burner lines, answering services Sterling had set up 5 years ago when he'd first realized how useful a ghost employee could be. Within 90 minutes, he'd activated those numbers. A woman's voice, actually his office manager, Rebecca, with a slight accent, spoke to the investigator from Denver Medical Group's Risk Management Division. "Yes, we had concerns about her clinical judgment. Boundary violations with patients. She seemed emotionally unstable, sometimes withdrawn, sometimes aggressive. We counseled her twice. Eventually we let her go." The third call came from a consultant named Marcus Webb, no relation to the Army Ranger anesthesiologist, but Sterling didn't know that yet. Webb arrived at Oak Creek Memorial at 3:22 p.m., leather briefcase, glasses that caught the fluorescent light like a predator's eyes, and a manner that suggested he'd orchestrated 100 of these terminations before lunch. He and Sterling sat across from Hannah in a conference room on the administrative floor. Roger Hartman was there too, his golf shirt replaced with a blazer, his expression the careful blank of someone protecting assets. Hannah sat with her hands folded on the table. She'd changed out of her scrubs. She wore jeans and a long-sleeved shirt that covered the scars on her forearms, the one she'd never explained to anyone. Her hair was pulled back tight enough to make her cheekbones sharp as a knife's edge. "We've reviewed your employment history," Webb began, reading from a tablet. "We contacted your previous employers. There are significant concerns. One facility noted emotional instability, boundary violations with patients. Another mentioned aggressive behavior during staffing conflicts." Hannah's jaw didn't move. Her eyes didn't blink. When she spoke, her voice was level as a flatline monitor. "Those references. Are you calling our investigators liars?" Hartman interrupted, and his tone carried the weight of a man who'd never been questioned in his life. Sterling leaned back in his chair, arms crossed. His smile was the smile of a man watching his plan unfold perfectly. "What concerns me most, frankly, is the John Doe. She performed a needle decompression without physician authorization. That's practicing beyond her scope of practice, and it's grounds for immediate termination. She could have caused serious harm. She saved his life, Hannah said quietly. That's not your judgment to make. Webb's pen moved across his tablet. We're recommending immediate suspension pending a full investigation. Hospital policy requires that you surrender your badge and ID and leave the premises immediately. You may not return to any Oak Creek facility without explicit written authorization from hospital administration. The security escort was professional and impersonal. A man whose name Hannah didn't catch walked beside her to her locker on the 3rd floor. She reached into the metal compartment and withdrew 2 things, her pair of worn combat boots, the leather creased from 18 years of use, and nothing else. Not her stethoscope. Not her trauma shears. Not the extra socks or the granola bars or the dog-eared copy of Grey's Anatomy that had been her last comfort from a life she was supposed to have erased completely. Just the boots. She held them in both hands as security walked her to the elevator, and neither of them spoke. 3 days passed like they existed in a different dimension of time. Hannah existed in her apartment in a neighborhood north of Denver where nobody knew her name and the rent was cheap enough to be invisible. She didn't answer her phone. She didn't check her email. She didn't turn on the television or scroll through any news feeds. She sat in her kitchen with a cup of coffee that went cold, staring at the boots on the table, and the voice in her head, the one that sounded like every commanding officer she'd ever served under, kept repeating the same sentence: you were supposed to disappear. You were supposed to stay invisible. On the 3rd day, around 4 p.m., Hannah left her apartment and drove to the VA hospital in Aurora, 25 minutes east. Not as a provider. Not with scrubs or an ID badge or any of the apparatus of someone who knew what they were doing. She walked in wearing jeans and a jacket, carrying nothing but her keys, and sat down in the waiting room with 47 other people. The waiting room at the Aurora VA was a study in invisible pain. Old men with amputations. Middle-aged women with that particular 1,000-yard stare that meant Iraq or Afghanistan or both. A kid who couldn't have been more than 25, tapping his leg so hard the chair rattled. Hannah sat in a plastic seat that had probably been beige before it faded to the color of old bone, and she stared at her hands. These hands had held lives together. Not metaphorically. Literally. These hands had applied pressure to a hemorrhaging femoral artery while a Black Hawk's rotor wash shook the metal cargo floor. These hands had started and fought in a moving Humvee at 2 a.m. using nothing but the vehicle's interior light and the muzzle flash from a nearby firefighter's illumination. These hands had closed wounds with a 3-layer technique that only forward surgical team medics knew, the same technique that Army Ranger Captain Webb had recognized mid-surgery and never spoken of again. These hands had done things that officially never happened in a place that was supposed to stay classified forever, and now they were just hands. Ordinary. Useless. Sitting in a VA waiting room in Aurora while she waited to be seen for a fictional ailment. An old man sat down next to her. He had a 1st Cavalry Division patch on his jacket and his right leg ended just below the knee. He looked at Hannah looking at nothing, and after a moment he said, "You okay, miss?" Hannah realized she was crying. Not the quiet leak of tears, but actual silent sobs that made her shoulders move, that made her breath catch in her throat like she'd forgotten how to do it. She didn't even know when it had started. She opened her mouth to say something, an apology, a deflection, some lie about a difficult day, and instead what came out was, "I don't know if I saved anyone at all." The old man didn't ask what she meant. He reached over and patted her shoulder with the kind of gentleness that only a man who'd seen real destruction could manage. He didn't speak. He just sat there while she cried in a waiting room full of people who understood, without being told, that sometimes you could do everything right and still end up here, hollow and uncertain and wondering if any of it had mattered. This was rock bottom. This was the moment the military had warned her about in 2009 when they'd erased Senior Chief Petty Officer Hannah Clarke from every database, every roster, every record that said she'd ever existed. They'd given her a new name, a new history, a new life, and they'd told her, never surface, never claim the rank, never speak of what happened in that medevac operation or the friendly fire incident that preceded it or the contractor convoy whose shots brought the helicopter down and killed 3 soldiers who were supposed to be protected. They told her to disappear and she had. She'd become just a nurse, just a woman, just someone competent and invisible and broken in ways nobody could see. And for 18 years she'd managed it. She'd kept the secret. She'd swallowed the rage and the grief and the knowledge that the men who'd ordered the cover-up were still walking around in their uniforms, still getting promoted, still giving interviews about honor and accountability. She'd held the truth the way a combat medic holds pressure on a wound, hard and steady and without complaint, knowing that if she let up even for a second, everything would bleed out. But that wasn't the worst part. The worst part was sitting here in this waiting room in Aurora and understanding that she'd lost everything anyway. The military had taken her identity. Sterling had taken her job. And she'd done it all to herself by being good at what she did, by showing competence in a hospital full of men who were afraid of competence in women, by saving a life that cost her the last stable thing she had. She stared at her hands that had held lives together, and she wondered if they'd ever held anything that lasted. If she'd saved anyone at all, would they remember her? Would it change anything? Would any of it matter once she was gone? The waiting room hummed with the sound of fluorescent lights and the shuffle of chairs and the distant voice of a nurse calling someone's name. Hannah sat among the veterans like a ghost among ghosts, and she had absolutely no idea that in room 12 of the ICU at Oak Creek Memorial, a 375th Ranger named Robert Mendez was waking up with the first clear thought he'd had in 72 hours, and that thought was a single word that would blow apart everything Sterling had built. The call came at 4:41 a.m. on the fourth day. Hannah was staring at her apartment ceiling, the kind of darkness that only exists in the hour before dawn, when her phone buzzed against the nightstand. Unknown number. She almost didn't answer. Then she heard the voice on the other end, not a nurse, not a doctor, but a man whose words came slow and deliberate, each one costing him effort. "I need Hannah Clarke." Her breath caught. She didn't move for 3 full seconds. The voice belonged to Staff Sergeant Robert Mendez, the ranger she'd pulled from the Baghdad operation in 2009, the one whose badge had tumbled onto the trauma bay floor, the one whose eye she hadn't wanted to see when he was dying. The voice of a ghost asking for her by name. "I'm here," she said. "Thank you," Mendez whispered. Then the line went dead. Hannah was dressed in 7 minutes. Scrubs. Hair pulled back. The worn combat boots laced tight, muscle memory from a life she wasn't supposed to claim anymore. She drove through empty Denver streets at 5:15 a.m., watching the city transform from darkness to pre-dawn gray, and she knew, with the kind of certainty that comes from surviving things that kill other people, that everything was about to change. The ICU doors at Oak Creek Memorial were flanked by 2 hospital security guards when she arrived. Behind them, Sterling paced like a caged predator, his phone pressed to his ear, his face the color of old concrete. When he saw Hannah, his smile split open like a wound. "Officers," he called out, turning to the guards. "This woman is trespassing. She was terminated yesterday. Call the police. I want her arrested." The guards looked uncomfortable. One of them cleared his throat. "Dr. Sterling, we need to see the termination documentation from HR before. I don't care what you need. She's not authorized to be in this hospital. Remove her." Hannah didn't move. She didn't argue. She simply stepped forward as if Sterling wasn't speaking, as if he was background noise, the hum of fluorescent lights that no one actually hears. The guards hesitated. Security guards always hesitate when someone moves with absolute certainty that they belong. It's a tell that separates people who have nothing left to lose from people who still believe the rules apply to them. She walked past them into the ICU. Mendez lay in bed 7, tubes running from both arms, monitors recording the steady return of his heartbeat. His eyes were closed. Then he opened them, and they moved across the room until they found her face. For a moment, nothing happened. The world held its breath. His jaw tightened. His eyes glistened. And then his lips moved around a single word that changed everything. Phantom. The word hung in the air like a live round. The MP stationed in the hallway, and there were 2, their uniforms crisp, their posture military, suddenly snapped to attention. One of them keyed his radio and spoke in a voice that could have been carved from granite. "Command, we have visual confirmation. Senior Chief present." Sterling froze in the doorway, his face draining of color so quickly Hannah thought he might collapse. He didn't understand what was happening. He didn't understand that the word phantom wasn't a name, it was a call sign, and the only people who knew it were the ones who'd been there, who'd watched her work in the dark under fire, who'd seen what she could do with 2 hands and a 14-gauge needle and the kind of composure that comes from having already survived the worst. The door opened again, and a woman walked in, mid-50s, dark hair pulled back, wearing the shoulder boards of a 2-star admiral. Behind her came a man in a dress navy uniform, and then another woman in a dark suit who introduced herself quietly as Special Agent Catherine Morris, FBI. But first came Mendez's daughter. She was maybe 30, with her father's eyes, and she stopped 3 feet from Hannah and stared at her with the kind of intensity that made Sterling take a step backward. "You're a senior chief petty officer," the daughter said. Not a question. A statement of fact, delivered the way someone speaks about something they've known their whole life but had to wait to say out loud. "You saved my father. My mother told me everything. About 2009. About the operations." Beside her, Mendez's attending physician, a young resident named Dr. Cho, held a folder that trembled slightly in his hands. He opened it and began reading, his voice climbing in volume and pitch as he processed what he was looking at. "Declassified for hours ago," Cho said, looking directly at Hannah. "Senior Chief Petty Officer Hannah Clarke. 3-tour deployment. Forward Surgical Team Medic. Baghdad 2009. 17 documented combat saves. 17. You were in a classified medevac operation. The report says you performed emergency cricothyrotomy in a moving Black Hawk under fire." The word, cricothyrotomy, hung in the air. A surgical airway. A procedure done when there's no time for anything else, when the patient is seconds from dead, when your training is the only thing standing between life and absolute darkness. Sterling's phone fell from his hand and shattered against the tile floor. That evening, the hospital lobby transformed into something that belonged in a courtroom instead of a medical facility. News cameras were positioned near the main entrance. Staff gathered along the hallways. The board president stood near the elevators, his face the color of spoiled milk, while hospital administration scrambled and whispered into phones and tried to figure out which way the wind was blowing. Then the doors opened. Rear Admiral Patricia Vance walked in like she owned the place. Dress whites. Service ribbons arranged in perfect rows. The kind of presence that made the air pressure change, that made people unconsciously stand straighter, that announced without words that authority had just entered the room. Behind her came a uniformed officer from the Naval Criminal Investigative Service, and behind him came 2 more FBI agents with folders thick as phone books. "Dr. Marcus Sterling," Vance said, her voice carrying across marble floors like a command to a firing squad. "You suspended a decorated combat veteran for saving a patient's life using the exact skills she earned under fire. Using skills that are classified, that she risked her life to learn, that she was ordered never to claim." Sterling started to speak. His mouth opened. Nothing came out. "NCIS has been tracking supply fraud at 7 hospitals across the Western region," Vance continued. "Your arrangement with trimmed medical supply. Charging for equipment never delivered. Inflating trauma codes to justify orders. Kickbacks deposited into your wife's consulting firm. $247,000 over 14 months. The board president tried to move toward the exit. An FBI agent stepped directly in front of him, not touching, just present, immovable as a wall. "Mr. Hartman," the agent said quietly, "you're also named in the investigation. Please remain where you are." Vance turned to Sterling again. "Your medical license is suspended pending federal investigation. You are terminated from Oak Creek Memorial effective immediately. You will surrender your credentials now." The uniformed NCIS officer stepped forward with a pair of scissors in his hand. The gesture was practiced, ceremonial, the way military personnel perform official acts. He cut the lanyard from Sterling's badge in one clean motion, and the credential fell to the floor with a sound like a gunshot. Sterling stared at it, then at his hands, then at the cameras, then at Hannah, who stood at the edge of the lobby watching him collapse. His voice, when it came, was barely a whisper. "I have contracts. I have arrangements." "I have?" "You have nothing," Vance said. "Security will escort you from the building. The parking garage cameras are recording. The police are standing by if you make this difficult." They walked him out past the gathered staff, past the patients and visitors, past the rolling cameras that would capture his face for the evening news. His photograph would be on every local station by dinner time. His medical license would be suspended by the state board by morning. The pharmaceutical companies would cut all business ties by end of business that week. The civil suits would start filing by the following Monday. An FBI agent approached Hannah as the doors closed behind Sterling. She was younger than Hannah expected, maybe early 40s, with the kind of tired eyes that come from working cases that involve classified operations and buried bodies. "Hannah Clarke," the agent said. "I'm Agent Morris. We need to talk about your final mission in 2009. It's been unsealed. It's now evidence in a federal war crimes investigation. The officer who ordered the operation, Lieutenant Colonel David Reeves, is being charged with unlawful command responsibility for the deaths of 2 Army Rangers and 1 British Army medic. Your testimony will be critical." Hannah nodded once. She understood. The mission that was supposed to stay buried, the operation that killed people she'd trained with, the classified medevac that had erased her from every database and told her to disappear, it was finally coming to light. "I'll be there," Hannah said. 6 months later, the federal trial of Lieutenant Colonel David Reeves would conclude with a conviction. Hannah's testimony, delivered from behind a security partition, her voice steady as a surgical laser, would be the linchpin of the prosecution's case. Mendez would testify. Captain Webb would testify. The Army Rangers who survived the 2009 operation would testify. And the truth would finally emerge, classified no longer. But on this night, Hannah did something smaller and more important. She walked to the nurses' station where she'd worked for the past 3 months in her new role as trauma coordinator. The job had been offered to her by the new medical director, a physician named Dr. James Okonkwo, who understood exactly what he was looking at when he saw Hannah Clarke work. The memorial wall stood beside the station, photographs of staff members who died in service, names carved into a small brass plaque. Hannah reached into her locker and withdrew 2 objects, the combat badge that Mendez had returned to her, pressed into her hand the morning he was discharged, with the words, "This belongs with you." The other object was a pair of worn combat boots, their leather cracked and faded, their laces frayed, their soles marked with the dust of streets and buildings and compounds in a country on the other side of the world. She placed the badge on the memorial wall. She placed the boots beside it. A new nurse named Sarah, maybe 24, with the kind of bright-eyed competence that comes from believing the world is still good, stopped by the station an hour later and stared at the display. "Who are those from?" Sarah asked. Hannah was organizing the trauma bay supplies, running a mental inventory, checking dates on medications, doing the kind of invisible work that keeps people alive. She paused and turned. "Senior Chief Petty Officer Hannah Clarke," she said. The first time she'd spoken her rank out loud in 18 years. It felt like opening a window in a house that had been sealed shut since 2009. Army Ranger Medic. Baghdad deployment, 2009. She saved 17 lives under fire. That badge belonged to one of them. Sarah's eyes widened. She looked at the boots, then at Hannah, then back at the boots. "That's you," Sarah whispered. Hannah didn't answer. She didn't need to. The answer was on the wall, displayed in the light, finally allowed to be seen. Some nights, she still flinched at dropped clipboards. Still felt the weight of the one she couldn't save. 18 years of carrying secrets had created patterns in her nervous system that didn't erase themselves in 6 months. But when she taught the 3-layer closure technique to residents on Thursday mornings, showing the precise angle, the tension, the way your hand has to move like you've already done this 1,000 times, muscle memory takes over, she'd tell them, she remembered. She didn't just survive. She saved 17 lives under fire. She's still saving them now. Senior Chief Petty Officer Hannah Clarke doesn't hide anymore. Hit that like button if you appreciate the nurses and healthcare workers in your life. Drop a comment if you've ever worked in medicine or know someone who has. Subscribe and let's see what happens next.